If you have a history of motion sickness, it is critical to discuss this with your anesthesiologist before surgery. Patients with a history of motion sickness have a 2 to 3 times higher risk of developing postoperative nausea and vomiting, PONV, compared to those without such a history. Motion sickness can prolong recovery time and increase the risk of postoperative complications such as aspiration pneumonia due to PONV. This is because individuals who are prone to motion sickness have a heightened sensitivity of the vestibular system, part of the inner ear that controls balance, chemoreceptor trigger zone, and the vomiting center in the brainstem. Anesthesiologists must be aware of a patient's history of motion sickness and take precautions to minimize its impact on the anesthesia process. This may include administering antiemetic medications before surgery, adjusting the anesthesia dosage, or using alternative anesthesia techniques. By addressing motion sickness as a potential risk factor, anesthesiologists can improve patient outcomes and ensure a smoother surgical experience. A history of motion sickness is one of the 4 major risk factors for PONV. The other factors include female gender, non-smoking status, and use of opioids, APFL score. Scopolamine, available as a patch, is often applied behind the ear before anesthesia and surgery if someone has motion sickness. Scopolamine, an anticholinergic medication, is contraindicated in several conditions due to its potential to exacerbate symptoms or cause adverse effects. Such conditions include glaucoma, especially narrow angle, obstructive gastrointestinal conditions, urinary retention or bladder obstruction, myasthenia gravis, hypersensitivity or allergy, children and elderly, and pregnancy and breastfeeding.